Nakatikim na ba kayo ng burger in a bowl? Yes, this is a traditional beef burger but served in a bowl. Bakit ito in a bowl? Because this is also called a bunless burger. Kung hindi pa kayo nakapag-order ng bunless burger noon, maybe you should try. And bakit ako nagba-bunless burger? Why do I go for bunless burger and the many members of Life Without Rice? Dahil po, we try to avoid the carbohydrates sa ating burger. Maraming nagsasabi that burgers are not really healthy kasi nga sabi nila it can be related to fast food, maraming unhealthy na mga ingredients, pero sa totoo lang, a real burger is actually one of the healthiest form of food except if you take it with the bun or with the carbohydrates or with the fries in it. But the burger alone, together with the vegetables, the greens, pwede itong maging healthiest food that you can ever get. I ordered this in Hudson Coffee. I'm currently here in Changi Airport in Singapore. So, nagta-transit po ako dito. I'm a transit passenger before finally going back to the Philippines. Galing akong Dubai. If you've been following my page, you would know na kagabi, nandun tayo sa Dubai Airport. And right now, we are here. So, I'm gonna show you kung anong laman ng burger na to. Of course, it is very expensive kasi dito binili. But, if you are preparing this in your home, this is not expensive at all. If hindi nyo pa nakita, meron akong recipe for a very healthy burger made up of 2 kilograms beef, 1 kilogram liver, and you can also add in pork kung kumakain kayo ng pork, but just the burger and the liver alone, the beef, ground beef and the liver alone, that could be your healthiest choice. So yun lang, asin per kilo of beef, usually naglalagay ako ng 1 tablespoon worth of salt. And you can also add pepper. Hindi nyo kailangan mag-worry na hindi ito didikit. Walang kailangang itlog, walang kailangang cornstarch, walang kahit anong extender. Once you get to know the real taste of 100% pure beef, kahit saan kayo lagay, alam na alam mo agad if it has extender or eto ay 100% pure beef. Because 100% pure beef patty could be your healthiest form of burgers. So, especially in the Philippines, most of our, if not all of the available locally grown beef there are grass-fed. Although merong mga nagsasabi na before they are being processed into meat products, sila ay pinapakain ng grains para tumaba. But that's many little things that we should concern ourselves about, because majority of the time nang lumalaki yung mga baka, they are still grass-fed. So, hindi kailangang mahal yung pagkain. Yung liver naman, just 100 grams of liver in a week is already okay. So, in a month, 1 kilo. Okay? In 2 months. In 2 months and 2 weeks or 10 weeks, 1 kilo ng liver. It's not that expensive. So, kakaunti lang kailangan. Liver is considered to be one of the most nutrient-dense foods sa atin, but we should also not overdo it because hindi rin kailangan natin yon. Anything too much is not okay. So, I ordered a bunless burger. Somewhat in many countries, accepted na marami talagang taong naglo-low carb. Hindi lang nila tiniterm na low carb, but they are avoiding rice, they are avoiding bread, they are avoiding pasta, and they are already aware. So, I wasn't sure if they are aware of bunless burger. I just ordered the deluxe burger, but if they can change the bun into lettuce, and the teller one, the woman attending me, instantly said, "So, do you want a bunless burger?" Parang nahiya pa ako, no? Alam na pala nila yung bunless burger. So, it's already automatic for them, and they serve it in a bowl. So, it's burger in a bowl, and what I ordered is the regular beef. Papakita ko sa iyo yung laman. So, this is the beef patty. It looks like a quarter pounder siguro. Sobrang laki, oh. So, this is beef, and then I added, nakalimutan nila yung egg. Or eto ba yun? Nakalimutan nila yung egg. I'll ask. Tingnan ko nga yung resibo ko. Because I added an add-on of turkey bacon. So, nagpa-add ako ng turkey bacon and also avocado. Yeah. And cheese. Egg and cheese. Dapat egg and cheese to. Bakit wala akong nakikitang egg? So, tatanungin ko mamaya. And there's cheese also there. Nilagyan nila ng onions. And this one is some greens. So, this is a bunless burger or burger in a bowl, and so mahirap siyang kainin kung wala kang utensils. Para sa akin, yung buns is just a carrier, para lang siyang sisidlan ng burger. But if you have to eat it this way, you really need a bowl. And so humingi ako ng utensils we have here para pwede natin siyang kainin. So why do we go for a bunless burger? Bakit natin ini-eliminate yung buns and the carbohydrates in it? Because if we want to really optimize our health, we want to lower down or control our carbohydrate intake. Hindi po natural para sa tao na parating kumakain ng carbohydrates, parating nagpapataas ng kanilang blood sugar at nagpapataas din ng insulin. We are brainwashed that ang pinaka-importante sa lahat is just thinking about the calories or just thinking about the blood sugar. But the end point of it all actually ay mas importante, alalahanin natin kung gaano kalaki yung insulin impact ng kada pagkain. And among 3 macronutrients, the carbohydrates, the fats, the proteins, it is the carbohydrates that will induce too much insulin effect. And ang insulin po, ito yung ating hormone sa katawan na tumataas siya every time we eat. Kahit anong pagkain actually, nakaka-induce ng insulin. But it's the carbohydrate that spikes our insulin in response to spike in blood sugar. So kapag mataas yung blood sugar, papataasin si insulin para mapababa yung blood sugar. Yun lang yung alam natin, yun lang yung na-emphasize sa atin. What we fail to realize is that insulin can also do so many other things in our body. It is an anabolic hormone, it is a building up hormone, and it is a fat storing hormone. Kahit hindi ka tumataba, whenever you're already on insulin high, chronic insulin level, yung katawan mo is not destined para siyang na-deactivate yung kanyang fat burning process. So sa mga tao na parang tabain talaga, pwedeng mag-build up yung fat sa kanilang katawan. Meron namang iba na hindi sila obvious na tumataba, but the fats in their body is deposited elsewhere. Pwedeng magkaroon ng gallbladder stones, fatty liver, kahit payat. Yung iba tumataas yung blood lipids tulad ng VLDL, LDL, triglycerides, and many more. Now, for those of you na naglo-low carb na tumataas yung LDL, huwag masyadong matakot, especially if you are in a normal HbA1c, yung blood sugar control for the last 3 months, because that will only go to show that you are actually having a good control with your blood sugar at wala itong inflammation. There are other markers of inflammation. Yung importante, walang inflammation na ongoing sa iyong katawan, and that elevated LDL is the large density LDL. I made a video about it. If you want to know more about LDL, you can search it, because not all LDL are created equal. If you will just be afraid or you will stop doing low carb simply because tumaas yung LDL mo, kahit mababa yung triglycerides mo, kahit mataas yung HDL mo, kahit sobrang ganda ng iyong blood sugar control and no signs and symptoms of inflammation or any problems, then sayang yung benefit na makukuha mo if you continue your low carb. So that's why if you are afraid or not yet fully knowledgeable, you've been following our page, our groups for example, but then hindi nyo alam how confident you are, if this is really right, if this is healthy, then I suggest you join our masterclass so that you can fully grasp the whole concept. Also for you to have a peace of mind. Kasi hindi naman pwede na susunod lang kayo without really knowing what's going on in your body. The real low carb nutrition that we promote is the right one. Ayaw namin yung basta low carb lang, basta tinanggal lang yung kanin, low carb na agad. Basta tinanggal lang yung tinapay, low carb na agad. I'm telling you that I'm going to eat a low carb bunless burger, but I'm explaining to you why I'm doing this. And it is because a bun, yung half ng bun lang, is actually equivalent to about 5 teaspoons of white sugar. Ganun po ka-dense yung sugar na laman ng mga pagkaing full of starches. I discussed yesterday about the different kinds of carbohydrates, the fiber, to which we don't count when it comes to calories kasi hindi naman siya nako-convert directly into calories. But it's the starches and the sugar that we should avoid. For the longest time, walang doktor magsasabi sa inyo na kumain lang kayo na kumain ng sugar, because all doctors know that sugar is really not good. Alam natin lahat how it can spike our blood sugar, how it can lead to diabetes, to complications, to inflammation, and many more. Wait, adjust muna natin ito ng konti. Okay, so, but the starches, ito yung parang gray area. Next time, I will talk more about oatmeal at bakit hindi ako kumakain ng oatmeal. Next time na yan. But for now, the starches, ito yung parang pinaka-confusing, pinaka-gray area, especially na mentioned from the dietary guidelines. It is usually promoted as healthy. Kasi nga, it is full of fiber, and we thought that fiber is the end-all, be-all when it comes to good food. But actually, yes, it's good to have fiber, pero it's not worth it when it comes to the starch that is there, the amount of sugar or glucose na equivalent ng starch na nandyan. Say for example, a cup of oatmeal, meron siyang approximately about 8 teaspoons of white sugar per cup of oatmeal. So, it's not really the best when it comes to healing. Kasi nga, nagkasakit na tayo because of too much sugar in our system, and now we are still trying to let people eat more of it. If that's the case, then of course it is consistent. It is just normal for those who are doing it na hindi talaga reversible o walang chance na magkaroon ng remission ng diabetes. Of course, that is true if you are eating those things. But for us who have a lot of experience when it comes to patients we manage with diabetes, but following the protocol properly, following the low carb and doing it the guided way, the practical and most importantly the safest way, they are not having any of those problems, and right now they are on remission. So yung remission po is yung naging normal yung kanilang blood sugar control without the need for medications, but just the need for adjustment sa kanilang kinakain. And low carb nutrition is one of the recommended dietary changes or medical nutrition therapy ng ADA, ng American Diabetes Association. Recently published lang. So, if ever hindi pa yan nasuggest sa inyo, try to ask. Baka hindi pa nabasa o baka hindi pa na-disseminate kasi alam natin, medyo late yung Pilipinas, di ba? But it is there. I already made a post about it and also a video about it. Merong 9 types of diet na nire-recommend ngayon ng American Dietary Association for Diabetes as medical nutrition therapy. Ibig sabihin, yung pagkain mismo, yung type of diet can really be used as an adjunct. Pwede siyang i-pair up with the standard medical practice to achieve better healing, better nutrition, better improvement when it comes to blood sugar control. Kasi yung biggest predictor ng pagtaas ng blood sugar is just the carbohydrate intake talaga. So, after that one, mataas. Ang complications kasi ng diabetes would be hypertension, kidney problems, blindness, amputated leg, napuputulan ng paa, heart attack, stroke, all of those. Metabolic syndrome, lahat yon ay part ng ating mga complications ng diabetes. But diabetes, the strongest predictor is the blood sugar level, and the strongest predictor of blood sugar level is your carbohydrate level. So, ano ang kakainin ko to pair with this? So, I said ayoko ng fries. So, wala ng fries, wala ring no fries, and also no bread, but they gave me this. Hindi ko alam kung anong gagawin ko dito. But they gave that in the pack, but what I have meron lang akong water dito, yung galing pa tong Dubai na water na sobra, and sparkling water, and this is air soda or sparkling water, and of course, cafe americano. But this one in here in Singapore, they call this long black ba yun? What I usually order, since alam nyo na I don't drink strong coffee too much, but I drink coffee but not the bitter one. So, it's usually the small coffee in a large cup. Tapos, pinalalagyan ko lang ng ice all the way or hot water all the way. But since hindi naman masyadong maginaw dito, so I put ice. I can tolerate more cold now. So, yun lang muna for now. I'll see you in the next video. Maraming salamat. I hope to be with you all soon. If you wish to know more, we have a masterclass ongoing. You can enroll anytime depending on the disease that you want to deal with, or if you just want to optimize your health and prevent illness. Thank you po. Nandyan lang yung admins natin. Maraming salamat. I hope to to be with you and spend more time with you in the coming days. Remember to stay low carb so that we all stay safe. Maraming salamat. Goodbye!